Hello. Hello. Good afternoon. Are we ready? Yeah, listen, I want to thank all of you for coming out this afternoon. Dealing with our health is such an important issue, and you've shown a commitment by showing up. So first, I want you to give yourself a big round of applause. It's beautiful to see all of us out because, you know, one of the issues that we have in our community is that we don't pay enough attention to what's going on with our health. And yet, we have the worst health outcomes. And so we're going to get started. We got a phenomenal speaker for you. They'll give you some great information. But let me introduce the dais guest. To my far left is Patricia Milton, who's president of the Avondale Community Council and treasurer of Close the Health Gap. The Honorable Bishop Bobby Hilton, word of deliverance. We'll skip over the speaker, but his wife, Denise Velasquez, and Councilman Wendell Young. We want to welcome them as well. They live in Florida now, and Dr. Troutman used to be in Louisville, but has moved on to warmer climates. And I think that that makes a lot of sense to me. You know, before I get into this, you know, God does work miracles. Whether you believe or not, He absolutely does. And I've seen a miracle walk in this room this afternoon. A brother who was so sick that he was on his back for 9 months after he had a gastric bypass surgery, dealing with all kinds of health issues. And I went to see him in the nursing home. We talked frequently. A great brother. And he walked in today and surprised me because over a year he couldn't even get up and move. My brother Vince Hughes. Vince, stand up. Come on. Don't be bashful. Applaud yourself. You have no idea what this brother went to. Remarkable. And he's dropped about 125, 130 pounds. I know he doesn't mind me saying this because he said it soon he'll be going around the country to tell his story. And that's important. But the purpose of the meeting this afternoon is to begin the education of our people about health disparities. Too many of us don't know that we are the sickest and we die sooner than any other group in this nation. We need to know why. And it will shock you to find out that it doesn't have to be this way. I think Dr. King said it best, and it's over there on that board, that of all the forms of inequality, injustice in health is the most shocking and most inhumane. Think about that. That's so important. So at the end of our special guest presentation, we will entertain questions that you might want to ask. We're going to have a call to action where we're going to ask you this afternoon to join a movement in the greater Cincinnati region to raise the issue of health disparities. What I found is that we continue to wait on others to do for us what we must do for ourselves. The majority population has known well over 100 years the difference in our health outcomes versus the majority population. They've known it, but essentially have done nothing. Nobody should care more for you than you caring for yourself. We passed out some cards and we want you to sign the cards. We want you to be a part of the movement. We're serious about this because health is something to be serious about. We have to learn how to support and work in a collaborative effort. And every time I say this to people, people say it won't happen. I believe it will happen. I've been saying this for decades, and I'm going to say it until I leave this world, that we have to come together and work together. The Honorable Councilman Wendell Young will introduce our keynote speaker.
Good afternoon, everyone. Certainly it is a pleasure for me to be here, so on behalf of the city of Cincinnati, I will bring you greetings and say to you that not only is it a pleasure for me to be here, it's a pleasure for me to see you here and to be with you at what I see as the beginning of a movement. And I simply want to thank you for allowing me to be part of that with you. Ladies and gentlemen, I don't want to steal anybody's thunder, and I certainly don't want to be terribly repetitious, but I don't think we can say too much about the health of our community. Dwight Tillery has said it often and often and often. We have the worst outcomes, we work harder, we live shorter, we have the most diseases, and now our children are showing up with diseases that were always reserved for adults. I never thought I'd see the day when we talked about children with heart disease and high blood pressure. Diabetes, as you know, runs rampant in our communities. And there are many other diseases, and I suspect that our keynote speaker is going to cover many of those. But I think it's also important for you to know that this past week, Cincinnati City Council wrapped up the budget. I don't know how you feel about the budget, but if you're not happy with it, I'm not either. And I don't know if it was the best we could do, but it is what we did. But I'll tell you something I'm very proud of. Because in that budget, two agencies very important to this community had their funds cut to the point where they probably just about go out of business. You know I'm talking about the African American Chamber of Commerce and the Center for Closing the Health Gap. Now I want to tell you that when those cuts were announced, I was floored. So much so that I rarely criticize our mayor. But I do not understand how anyone who has lived their entire life in this city could believe for a moment that one of the best places to cut is with an organization whose entire mission is dedicated to keeping us out of hospitals and to try to keep us out of the graveyard for as long as possible. And so I had the absolute pleasure of leading the fight to restore the cuts to those agencies. And I want you to know that the $100,000 that was taken from the health gap is restored. That's in the budget. Now, I'm not here to make a speech today, and I'm not going to try to do that. But you know, African American politicians are routinely criticized with the question, what do you do for the black community? My answer is we don't do enough, but there's some of us who want to do more, and you're looking at one. So I'm here today, and I plan to be here throughout this movement. Now, you heard Bishop Hilton say that he's in cooperation with the Center for Closing the Health Gap, and you heard Dwight Tillery say that he's in connection with working with NAN. I'm in connection with working with both of them, and I'm proud of it. And so now, having said those things, let me get to the real business at hand, because I have the absolute pleasure of introducing to you Dr. Adewale Troutman. Dr. Adewale Troutman identifies himself through his commitment to social justice, human rights, community activism, health equity, and national and global health. His life's work has been a testimony to this fact. Dr. Troutman has an MD from New Jersey Medical School, a master's in public health from Columbia University, master in Black Studies from the State University of New York in Albany, and as of October 2009, National Board of Public Health Examiners. He's featured in the nationally televised PBS series, Unnatural Causes, Is Inequality Making Us Sick? Dr. Troutman serves as a member of the National Board of Public Health Examiners, the Academy for Health Equity, the Health and Human Services Secretary's Advisory Committee on Health Promotion, Disease Prevention, Healthy People 2020, the Health and Human Services Secretary's Advisory Committee on Infant Mortality, the Board of Directors of Public Health, Law, and Policy, the Executive Board of the American Public Health Association, the African American Heritage Center, and the National Association of County and City Health Officers. Lastly, Dr. Troutman is an active member of the Black Caucus of Health Workers, and he also served as the former BCH president. Ladies and gentlemen, I'm sure there's more, because this obviously is a very humble man, but he's done so much. Would you please put your hands together and give a very warm Cincinnati welcome to Dr. Adewale Troutman.
Black folk on the critical list. 80,000 souls lost in excess. 80,000 Malcolms, Martins, Harriets, and Sojourners, never to see, to be, to move the race. Black folk on the critical list. Black folk on the critical list, 1 in 21 be the victim of another's gun. He holds the gun, but he be the mirror image of me. Can't strike out, must self-destruct. Black folk on the critical list. Black folk on the critical list, needles primed, mother's wine, all asking why. Black folk on the critical list. Black folk on the critical list, now the virus. Hey, pass it around, everybody got a hit in the taste. Failed to date, let's try the genocidal dance one more time. Black folk on the critical list. Black folk on the critical list, from pipes to pyramids, everybody buying the hype that we be less than he. Black folk on the critical list. Black folk on the critical list, but who's the tone for the souls of black folk? From lost, rotting bones on ocean floors to fiery deaths in Brooklyn streets, black folk on the critical list. Then where is the MD who stands up to be? Where is he who stands up to say, victim no more, empowered to grow into the light of ancestral clarity? Where is the beaming in the self-empowered glow of knowing who she be and being who she must? Where are we connected by the chain of continents and generations past, strengthened by the Sankofa principles of backwards looking, forward acting, social revolutionizing, and uplifting eyes? She is here, he is near. It's up to me, it's up to you. That's all it takes. It's just to do. Stay connected to who we are. Let no one tell you the journey's too far. Our life, it's our right. One people, a tradition to fight, from Soweto to St. Louis, from Harare to Harlem. From death in the streets, no more death in the streets. No HIV to defeat. Oppression a dream, things to be as they seem. Victory just to claim. Kings and queens again reign. Claiming power from within, right the wrongs and we win. Social justice in our streets. Social justice in our streets. From pipes to pyramids, the circle is complete. Good afternoon, Cincinnati. I'm so happy to be here, so honored to be back in Cincinnati again, to be standing here at the podium with this fine organization and this brilliant leader, Dwight Tillery, who's already gotten one round of applause. I'd say give him a second one. I got a few minutes to spend with you this afternoon talking to you about something that's very near and dear to my heart. But I wanted to start with this photograph, and I know what that other thing in the corner there is. Forgive me, please. Okay. You heard part of my introduction, who I am. The rest of who I am, I'm going to spend two couple minutes for you talking about the fact that I was born in the South Bronx, New York City, in what's called Fort Apache. This is my family here. One of the things that we know today about anybody who looks like this, those three young black boys on that picture are less likely to have a life expectancy over the age of 65, more likely to have diabetes, heart disease, cancer, more likely to die from prostate cancer, less likely to graduate high school, more likely to be in the criminal justice system, more likely to be on the outside rather than the inside, more likely to be despised and loved. And all these things contribute to the early death of African American population in general and black men in particular. I was born into this life. My mother, no father, left when I was 4 years old. My brothers and myself living in a very, very poor community. And I always say we were so poor we couldn't even use the OR at the end of the word. We were just po. I was also born into a period of, I was born in 1946, but raised in New York City in the 60s and the 70s with the Black Power movement, Civil Rights movement, the rise of the Nation of Islam, African liberation movements all over the world, a very, very hot time in the US. And for the young people in audiences that I speak to, I always tell them, you really missed it. I mean, the 60s were alive with activism and love and justice and brotherhood and sisterhood. Is a true renaissance in the African American community. And this is what I was born into. We call it ghetto, we call it segregation. You know, one of the things that stands out in my mind is a 16-year-old driving down to Virginia and going to Howard Johnson's and walking up to the front door and seeing a sign across both glass doors, facilities for white only. The young people had never seen that. Some of the older folk like me, who were born in the North, raised in the North, didn't see it either, but it was a 16-year-old kid who was just totally amazed at the fact that somebody could actually write on a business, facilities for white only. And I think that started me on this task that I've adopted over the years. But the things that survived, that made me survive, that helped me to get through this, and overcoming the junior high school counselor who told me I should go to vocational school and be an auto mechanic. Overcoming the high school guidance counselor who told me, you're not college material, you should probably join the military. Somehow overcoming that based upon the work of people like Martin Luther King, and my personal savior was, aside from Jesus Christ, of course, was Malcolm X. And the writings of Malcolm X, the teachings of Malcolm X, talking about justice and African heritage and African history and who we really were, and why this was inconsistent with who we really were, the life that we lead, the oppression that's constantly on our heads, and the need that we need to be unified and, as Dwight said, come together to make a difference. I believe in the power of one. I believe in the power of one. There are many examples around historically and around the globe of the power of one. I listed a few here. We all heard of people like Mother Teresa and Mahatma Gandhi, of course. Martin Luther King and Malcolm X stand as shining examples. Steve Jobs, somebody who we added to this list, is somebody who's just changed the technology in the entire globe based upon the power of that one person. I was very delighted to put, I probably spelled your name wrong, Dwight. Got it right. Dwight Tillery on here as a leader in the developing movement of social justice around health in this country. Believe me, I travel around the country a lot, and I can't tell you any place else that's as far ahead as Cincinnati is in putting together a movement based upon social justice, focusing on right as a human, as a human right, health as a human right. We also list Angela Davis, who we all know. I shouldn't say we all know, the younger folk. I would encourage you to go and Google, since you're into computers, Google Angela Davis if you've never heard of her, this dramatically brilliant woman. Tiananmen Square is a reference to a 3-minute video clip called The Power of One, where a child walks in front of a tank in Tiananmen Square and literally stops the advance of that tank. That one person. How much power is in that? And of course, Nelson Mandela, my goodness, dramatic leader, spent 27 years in prison and still came out to be South Africa's first black president and is still revered around the world. We're all connected. Sometimes we like to think that we're not, but we are. Just a simple look at the history of the past 20 years and the spread of viruses like West Nile virus, which came from the Nile Valley and found its way to the United States, SARS, which came from Indonesia and spread all over the world. So many examples of the fact that we're all connected. The new physics, molecular science, we are all connected, and we need to recognize that what I do affects you, what you do affects me, and affects the next person. So we need to find ways to work together. Even the great philosopher Mufasa from The Lion King said, "We are all connected by the great circle of life." I'm going after a CNN announcer's job. So this is not a partisan political discussion. It's certainly not a lecture. In a sense, it's a discussion on race, but not focused primarily on race, and certainly not a discussion on the medical model. I'll tell you my prejudice right now. The medical model is based upon individual attention to individuals who have problems or may have problems, diagnosing, managing disease, et cetera. We're talking about systems change. We're talking about a need to dramatically change the way health is viewed in this country, the way we view health, the way we view solutions to health problems, the way we view poverty, racism, social injustice, and its effect on health. One of the signs that's up here in the front says, where you live affects your health. One of the key elements of risk factors of all the things that we know of is zip code. Your zip code dramatically determines your health status, and that shouldn't be that way. So that's one of the things that we're talking about today. And of course, academic excellence, graduating from high school is an important element of health. Part of this discussion is about framing. What do we call things? And I'm going to say right now, one of the most important ones to me is the continued use of the word disparities, which we've gotten very accustomed to over the past 20 or 30 years or so. But disparities doesn't really tell the whole tale. Disparities simply means differences. That's all. So as a 67-year-old guy in a brilliant T-shirt, my health is different from the 19-year-old young lady we met in the beginning of this hour a couple of minutes ago, just because we're so different. I'm a 67 male, she's 19-year-old female. There are differences in our health. Those are disparities. What we want to talk about are inequities. Inequities has the political power and the punch to adequately describe what's going on when it comes to the health of our populations versus everybody else. And I'll talk to you a little bit more about that when I get to that phrase. But the notion of reframing issues means that it helps to determine how you analyze something, where the resources go, when you've met the goals you've set for yourself, who is your ally and who might be your enemy at whatever level of government or civil life there might be. Long list of reframing issues. I wanted to talk to you about creating health equity versus eliminating health disparities. And the notion of health versus healthcare is another very important difference of how we define something. If I ask the audience, not right now, for a definition of health, probably 95% would say hospitals, clinics, doctors, diagnosis, management, treatment of disease. That's health care. Health is the full spectrum of all the forces that impinge on the health of populations, from sundown to sunup, to like transportation, like housing, like community safety, like educational attainment, educational achievement, high school graduation rates, jobs, socioeconomic status, continued existence of racism, discrimination, and stereotyping in all parts of this of the system that we live in. All of that is health. And I'll tell you now that if we are ever to find a way to close the gap in excess death and bring about true health equity, it has to be based upon that notion of all those factors that control the health of populations that we have to find a way to address. And the best way to do that is through a broad-based social movement or social revolution, and we'll talk more about that as we get through the presentation. I didn't do this slide 5 minutes ago when I came in here. I use this all the time, and I'm certainly glad to see that Dwight and others are using it as well. And it's been mentioned to you 2 or 3 times already, of all the injustices in health, the most shocking and inhumane, by the great Martin Luther King. Dwight asked me to share with you some of the data. I usually don't spend a lot of time on the data because my sense is that people generally know that we're in pretty bad shape. But because of, he threatened me if I didn't do this, that he was going to take me out behind the woodshed and whip my behind, if you can imagine. So one of the posters on the side is from an article that David Satcher did. Actually, I had the privilege of being a co-author with him on this piece called What If We Were Equal, looking at death rates between 1960 and 2000. What's important, one of the things that's important about this is that the number of excess deaths in the African-American community by calculation grew from what was felt to be 60,000 excess deaths in 1985, not to 40 or 30, but to 83,000 in the year 2002. So the numbers increased over time. And again, it stands as a testament of the fact that we have a long way to go. What we did was analyze if things were equal, what would the death rate look like? We'd have 85,000 fewer deaths overall in the year 2000, 24,000 from heart disease, 7,000 from HIV, 4,700 infant deaths less, 22,000 from diabetes, and 2,000 fewer black women from breast cancer, if we were equal. In addition to that, we lose roughly 280,000 people a year in the African American community. The data says that 1 in 3 deaths in our community are excess deaths. Shouldn't have happened. Premature deaths, deaths based upon things like race and where you live and how much money is in your pocket and what language you speak, et cetera. And that's unjust, it's unfair. 16% of the nations without health insurance, but among Latinos it's 38%. Among African Americans it's 26%. So we are well off in terms of the percentage of folk who are uninsured. Very quickly, you know that we have a law now called the Patient Accountability Act that was passed a year and a half or so ago that's supposed to cover an additional 30 million people. But as of today, there are 50 million people who have no health insurance. Another probably 75 million who are underinsured, meaning they don't have enough insurance to do what needs to be done in the case of an emergency. And it's the #1 cause of bankruptcy in the United States, is healthcare, inability to pay for healthcare bills. So hopefully this new law is going to make a dramatic difference for us. Looking at death rates in the African American community compared to whites, and by the way, whites are used as a standard, but doesn't mean that that's the standard we ought to be looking at, because the health of the white population is not that great either when you look at across the country. So maybe there's another standard, but right now we look at this one, and when we look at black folk compared to white folk, there's a 77% difference in stroke rates higher amongst African Americans, 47% in heart disease, 34% in cancer, and look at the last one, 655% for HIV infection. That should make you wonder. Homicide, still a major problem in the African American community. The piece I wrote on black folk on a critical list talks about 1 in 21 lifetime chance of being a victim. If you're a young black male today, your chances of being shot and killed in a homicide are 1 in 21, compared to 1 in 369 for white women on the other end of the extreme. But that rate for African Americans is 6 times that for whites. Hypertension, you see, is greater. Life expectancy, shorter. When I was in Fulton County, Georgia, life expectancy for black men in Atlanta, the mecca of black folks in the United States, was 61.5, compared to the national average, which is about 79. I don't want to bore you with the numbers, but there are some important differences. Breast cancer rates, one of the things I would explain to you about breast cancer is that white women actually have higher rates of breast cancer than black women. But black women die at much higher rates than do white women, have less access to mammography, less access to broad-based treatment, and die sooner than white women who have the same disease. Last but not least is prostate cancer. And this always amazes me when I look at these numbers. Brothers in the audience, we have the highest rate of prostate cancer in the world. Not just in the United States or the Western Hemisphere, in the entire world. And if nothing else comes out of today's discussion, then a recognition by every black man in this room that you need to have a prostate cancer exam done, digital rectal exam and a PSA, that's a blood test. If nothing else comes out of this, then that's fine. You'll make your path to your urologist or talk to Dwight in the hospital about doing a screening program so you can get checked. We did some work in Fulton County, Georgia, working with professionals, 100 Black Men of America, professional organization, doctors, lawyers. We turned up prostate cancer by screening African American men in Atlanta who were doctors, but we're taking it, and I'll claim it myself, taking the traditional hard head role of a black man, saying, I ain't going to the doctor, I'm fine, I got no problems, I got other things I need to do. Wake up. So I want to spend a couple minutes on defining some of these terms that we use to put them in the context of health equity. This definition of health from the WHO, World Health Organization, broadens it enough for you to understand that you have to look at all these other factors to determine what the health of a population is. Because health, according to them, is the presence of physical, psychological, social, economic, and spiritual well-being, not merely the absence of disease. So even if you have no disease or infirmity, but these other elements of your life are not in sync, you are, by WHO's definition, you are not healthy. Don't freak out on the number of words on the screen. I'm not going to read all that to you, but this is the health equity is the concept that we're trying to develop here, because it talks about the optimal opportunity for all people to have the best health they can possibly have, regardless of who they are, regardless of where they are, particularly those who have experienced marginalization or oppression over decades and centuries. By the way, there is a phenomenon that a gentleman from Harvard University School of Public Health has called the slave health deficit. We don't have time to get into it today, but the notion that the history of African Americans and Africans in this country when it comes to health and health care and access to health and health care is influenced by what happened from 1619 up to today. It's not an isolated phenomenon. The fact that black folk on plantations didn't get health care, or if they did, it was only because the slave owner was trying to maintain his profit and keep a healthy stock of people. It's true that during slavery there was experimentation on slaves by professionals, but again, that's another, we could talk about that another time, but it's a very, very important area to recognize the relationship between what's happened over the decades and centuries to what we experience now. So it's institutionalized, and we'll talk about that in a minute when we talk about racism. And here's the health inequities piece that I talked about. Systemic, avoidable, unfair, and unjust. You could also put unnatural, meaning that the differences that exist between health and populations is not a natural order. You know, God didn't ordain that black folks were going to die 7, 10, 15 years sooner than white folk. God didn't ordain that all black people were going to be, when they walk into a clinic, they may be discriminated against because they look a certain way. That was not the natural order. The natural order is not that way. So if it's not a natural order, it's man-made, and man can unmake it. We can change the system to be effective for us and to eliminate the differences and have true health equity in the United States and the globe, by the way. This is a global issue. Justice, which I'm so happy to see this T-shirt. Justice and Health for All. Justice talks about fairness, moral rightness, equity, rightness in action or attitude. That's what justice is all about. We've been fighting for justice ever since we got here. You know, it's been one demonstration of the struggle for justice after another, after another, after another, through the assassinations, through the disorganization, through the plots by the federal government under COINTELPRO to break down organizations. And this is all stuff that's real. I'm not making it up, and I'm not being paranoid. But justice has always been at the crux of where we want to go. Social justice means taking that principle and broadening it to the broadest segment of society, and you see the word equity right in the middle of the definition of social justice. Equal access to societal power, goods, and services. Isn't that what we've been talking about for decades now? Equal access to societal goods and power in particular. It's wonderful to see council persons here from the African American community, you know, because that's an indication that they are committed to the community, the community is committed to them. But don't let any of them get off the hook. They need to continue to do what it is they're supposed to do for you as your representatives in this community. And if they don't, then they should face the penalty of not being responsive to what you need. And they're nodding, could they agree with me? And the penalty for an elected official who doesn't listen to the needs of his population is to be voted out of office. And one of the things that you will hear me say about this notion about what I can do, what do I do, or one of the things you do, we all individuals, is to know who your representative is. Make sure your representative knows who you are, not just at the local level, but the state level, the county level, and the federal level. Who's your congressional delegation? What have they done lately about health equity and social justice? What have they done lately about making sure organizations like like Dwight's are funded fully. Great to hear they got $100,000. Should have got $1 million. I know. But what are rights? They're entitlements recognized by legal and moral principles, and rights leads us to the discussion of health as a human right. What is a human right? This is a higher order basis, morally based and universal. We've all heard the words, we hold these truths to be self-evident that all men are created equal and endowed by their Creator with certain inalienable rights, and among these are life, liberty, and the pursuit of happiness. Doesn't say health, but if you talk to a constitutional lawyer, they'll tell you, you can't have life, liberty, and pursuit of happiness without having health. So it's the underlying foundation of the Declaration of Independence. Thomas Jefferson himself wrote about health. He believed in that notion, didn't make the document for some reason, probably some political backroom stuff. But we believe that health is a basic human right. And so does WHO, the World Health Organization. Sometimes people will say to me, Doc, is this written down any place that health is a right? Yeah, it is. Look at what WHO said, that the enjoyment of the highest standard of health, that's a key phrase here, the highest standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social condition. What a powerful statement that we can hold on to and say, it's my right. As a matter of fact, I said if you don't take anything else away from this, but prostate cancer screening, good. But secondly, we have to continue to affirm, we get to continue to affirm that health is a basic human right. That everyone, by virtue of the fact that they are alive and on this planet, is entitled to the same level of optimal health as everyone else. And to the extent that it does not exist, that is a socially unjust system. So I'll stand here today and say to anybody, the United States, when it comes to health of populations, is socially unjust. And it has to be changed. And part of the way we change it is by looking inside in terms of the power of one and organizing amongst our colleagues across the country. Why would I put Einstein up on the screen? Well, he's said many things, and one of the paraphrases he's attributed to Einstein, if you continue to do the same thing in the same way, expecting a different result, you're out of your mind. He didn't quite say it that way. That's a kind of an updated, Bronx stylized version of that definition. But essentially what it means for us is that if we continue to think that we can eliminate the gap in excess death by individual attention, then we are never going to get there. We have to be about systems change, capacity building, and changing the entire way we look at health in terms of social justice and human rights. And one of the new directions that we're now talking about, which is, I think you could probably trace it back decades, but it's becoming very popularized in the United States and around the world, is what are called social determinants of health. So we talk about things like cigarette smoking and physical activity and managing stress. Those are called individually based, but social determinants of health are the things that we now feel are more pressing and more important, like the sign over here that says where you live affects your health. And that would be the change that Einstein would say, switch up and I'll call you sane and not crazy. Here's the metaphor that we always use when I do these presentations. There's a stream, and if you imagine two people standing on the bank of the river fishing on a Sunday afternoon drinking a Bud Light, a baby floats down the river. And they're in awe and amazement, and before they can say anything, a second baby floats down the river. So the first guy throws his fishing rod down and jumps in the river to save the babies, which you'd expect would be the right thing to do, wouldn't you? The second guy throws his fishing rod down, but he turns and starts running upstream. And the first guy calls it. The second guy says, yo, man, where are you going? I need you to help me pull the babies out the river. He said, I'm going upstream to find out who's throwing the babies in the river and stop them. The metaphor means for us, the babies represent those 83,000 people in the black community who die every year, those who have dropped out of high school because they couldn't get a fair education, those who have been shot because they live in unsafe neighborhoods, those who don't attain high school graduation, those who don't have access to voting rights because they're felons and now they come back to the community and they can't vote. All these housing inequities, transportation inefficiencies, these are the things that are in the river. And these are the things that are upstream that we have to find out. Why are they there, and how do we in fact address them? The list is long. You can look these up at any School of Public Health, medical school, and perhaps Dwight has these in his office. We're not going to spend time going into each one of them, just to know that there are many, many social things like occupation, education, income, et cetera, and racism. But we believe that the best way to make a major sustainable difference is to approach health from the standpoint of social determinants. Now, this means that as an organization who's about building a social movement, that part of your social movement around health equity is looking at transportation and housing, looking at educational, why is the school system, why are 45% of black kids dropping out of this particular school system? And how does that affect the health of populations? And if we do something about that, they're going to be healthier. You have to find ways to demonstrate and organize around fair housing, around living wage. These are all health policy issues. We don't see them that way, but they are. They directly affect the health of populations. The things that education does for you, and one of the slides I did not bring today is looking at pregnant women in El Salvador. A study done by the World Bank showed that the infant mortality rate amongst those women who had no education was 100 deaths per live birth amongst babies in the first year of life. Now, just to give you some way to judge that, we're trying to get down to about 4.5 deaths per 1,000 live births. Amongst the El Salvadorian women with no education, they were 100 per 1,000 live births. When they looked at women who had a secondary education only, the number dropped to 25. So education is a major, major element in terms of the health of populations. Housing. I like to use some of these older quotes. Aristotle said, "Tell me how a man died and I'll tell you where he lived." He was an environmentalist, believe it or not. He didn't know it at the time. So here's an apartment in New York City. Look at this apartment from the context of health and healthy families. How can you maintain a healthy family in this environment? What she's doing in this picture, if you can't see it from the back, she's filling a pot in the bathtub full of water to probably boil a chicken. And I asked myself, if this is the bathroom, and she has to go to the bathroom to get the water, what does the kitchen look like? And how does that affect her ability to provide a healthy lifestyle for her family? So again, social determinants of health. The woman in the red shirt is from the New York City Health Department. She's doing what a lot of health departments, by the way, is there anybody from the health department here today? One person? Two people? Huh? Board chair? You? Congratulations. Where is your health officer? Haven't seen him? Okay. Health officer for the city of Cincinnati is Noel Macero. I know him for many, many years. Hopefully that you all will find a way to work together, because the health department is critically important to the success of such a movement. They've got resources, they've got skills, they've got data collection, they've got analysis, they've got connections all over the globe. So they become a really, really important part of what you're trying to do in Cincinnati. Anyway, getting back to this picture. So the woman in the red shirt is talking to mom about the signs and symptoms of asthma, when you should take your kid to the emergency department. That we call that downstream. It's after the fact. Mom is pointing up to the ceiling and saying, well, what is this stuff up here? Well, that's mold and mildew. The upstream approach, meaning going to the causation, would be to counsel a person to have a city ordinance that said that if you own a building, by law, you must maintain a building that's free of mold, mildew, moisture, and roaches, because they all affect asthmatic kids. So the best way is to stop the cause, not just to find out, well, now it's time to take you to the emergency room. That's the upstream approach. These are two pictures of housing in Louisville, Kentucky. The one on the older looking one is Cotter Homes, which is the projects, a housing project in metropolitan Louisville. The other picture is the same neighborhood after renovation and Hope 6 money. There's a question of power and policy. Hope 6 is a project from HUD designed to eliminate housing projects that are vessels of segregation and poverty, and replace them with newer units where they have mixed income. You know, some people may be on Section 8, some maybe have bought a house outright. The segregation of poverty is broken down by Hope 6 projects. And I'll tell you, and it's evidenced by history, when the previous administration was in office, that Republican administration, and this is not a partisan discussion, this is just facts, the money to Hope 6 began to dry up. They were going to kill the program. When the Democrats came back into power, they reinvigorated the program, and money is now flowing again for Hope 6. This is a very important health initiative. So this is a definition from a good friend of mine named Kamara Jones, who looks at racism and says that it's a system of structuring opportunity and assigning value based on how one looks. If you've never heard this before, there is no genetic marker that differentiates black folk from white folk, from Asians, from anybody else. It's called the Human Genome Project. So there is no genetic basis for race, but it's based upon how we look. So she has 3 levels: individually mediated, institutionalized, and internalized. And the example I like to use is if I decide that anybody with green hair is a criminal, my decision. Whenever I see somebody coming towards me who's green hair, I'm going to act appropriately because, after all, I've decided they're criminals. That's individually mediated, so it determines what I do in relationship to that one individual. I now work for the Housing Authority, and they ask me, I want you to write up a series of policies about who we rent apartments to. Well, because I believe that people with green hair are criminals, clearly I write the policy and says, nobody with green hair is getting an apartment in this complex. That's institutionalized, because now it's generation after generation is still on the books, the policy's there. Internalized is when as a person with green hair, I now decide that, you know something, you're right. I'm a criminal, I internalize that, I become helpless, hopeless, and maybe start acting like a criminal because that's what's expected of me. That's internalized. So those 3 levels of racism exist in this country today in the healthcare delivery system, in transportation, in housing, and education, et cetera. We could talk about that ad infinitum, but we don't have time for that because of the shortness of the day. But I also want you to think about this represents what's called the Trail of Tears. Have you heard of the Trail of Tears? A lot of people have. Cool. The Native American population, after being beaten in war after war after war and cheated in treaty after treaty after treaty, was forcibly marched from the east coast of the United States, like North Carolina and around that way, all the way out to Oklahoma. Forced marched in the winter and the snow, and thousands of them died en route and were unceremoniously buried on the side of the road. This is called generational trauma. So we talk about racism, that's generational trauma for us. Native Americans talk about Trail of Tears, that's generational trauma for them. And it is an important element of what happens when it comes to health in those populations, both in terms of the service they get and what they expect from their providers. I wanted to show you a way that we've been using to empower youth as a part of what we do. And we were thinking about this, Denise and I, in terms of presentation and your desire to build a movement. Well, a social movement around health has to include the youth. It's a major component of the work that we do. So this is something that we did in Louisville to get youth involved and engaged and empower them. It's called a Photo Voice Project, and you may be familiar with that, but I'll show you specifically what we did. We talked with 10-year-old kids at Phyllis Wheatley Elementary School about healthy communities and what it means to be a healthy community. What does that look like? And so we let them figure out the answer for themselves. We gave them cameras to go out to the community and take pictures of the neighborhood to represent healthy communities, and then come back to us and write them up, and we put them in a big poster and showed them to the mayor and the city council, and they felt like a sense of empowerment because something that they did was now being seen by the mayor and the city council, and that was very powerful for them. And I'm going to show you 3 examples of what we got from these kids. So first thing you notice is the picture. Doesn't look like the healthiest environment. The sidewalks are uneven, there are cracks in the sidewalks, there's not a whole lot of green space, there's garbage in the back. This is what this kid Denzel saw, and he said in his commentary, if my community were healthy, it would look like no people littering, people riding bikes, no people dealing drugs, kids playing in the park, no gunshots, parents and kids walking their dogs, no people smoking, parents taking their babies in the stroller to the park to walk them around the park. That's Denzel, age 10, and his experience around a healthy community. This one is Decorian, age 10. He says, my neighborhood has many train tracks and a really big factory that does something, I don't know what. There's a church, a community center, but there's no stores close to where I live. So he's in a food desert, and he already recognizes it's an absence of something that he needs in his life, in his neighborhood. And probably, well, we don't have the other one, I'm sorry. The last one talks about a kid who's afraid to go by the community center because people are outside with guns and he's afraid they're going to shoot him. Another 10-year-old kid. Health in all policies is something I would encourage you to take a look at, Dwight and others. It brings in the notion of transportation, education, housing, and their policies and how they affect the health of a population. It's a part of a wave that's moving across the world around health equity and social justice. And obviously, you have to engage the medical community and do what you do. Now, I already said that it's about much more than healthcare, but healthcare is a major part of the equation. And I know you've got great hospitals here in the city. They need to be lockstep with you in your work to develop a movement. They need to be clear that they have to get outside the hospital walls, that their mission may be to take care of sick folk. Yes, ma'am, you can do that again. Their mission may be to take care of sick folk, but they are an integral part of the community and have to be seen as such and have a responsibility to be a part of the movement, to be a part of supporting the movement, to be a part of job development, housing development, cleaner streets, safer streets, all the aspects of health. The hospitals and the healthcare delivery system has to be an integral part of that. And if they don't do what they're supposed to do, just like we talked about the elected official, your responsibility is to make noise. Is to go, I'm not going to say go sit on your doorstep. You make me sound like a 1960s sit-ins. But if that's what it takes, maybe that's what you need to do. But every one of those are strategic instances that are determined by the locale and where you are. But the hospital system has to be a part of the solution, or they're part of the problem. And you have to find a way to address that. So getting engaged with the hospital community, picking partners to be a part of the movement, not just the traditional. We partnered with a group in Louisville called Jobs for Justice. It's a health department. We partnered with a place called Jobs for Justice. We partnered with all kinds of unusual, not your typical partners. And a movement has to rely on a broad base from all levels. So we have food deserts in Louisville, and I'm sure you do here as well. We partnered with the YMCA to address a project called, we didn't have a name for it at the time, but finding a way to get fruits and vegetables into local community neighborhood stores throughout the city of Louisville. We partnered with the YMCA that provided us with some funds. And these kids you see in this picture are from the middle school around the corner. We helped them to launch a contest to name this effort. And they came up with the name Healthy in a Hurry Corner Store. So the money went to providing structure to build shelves. There's a refrigeration unit, which you can't see in this picture, and to provide a wholesaler to give an opportunity for the retail outlet to get fruits and vegetables at a cheaper price so they can make a profit. And they're doing quite well. There are about 8 of them now through the support from the YMCA. So again, I don't know exactly what you're doing here, what the situation is in terms of food deserts, but I know that they're here. Oh, yes. I can't leave out the mayor. The mayor, that's how important leadership is in an effort like this. This is the mayor who was there for 20-some years as mayor. He's now at the lieutenant governor's level. So I think the candidates from here, if they're still here, that's something they might take a look at, or you can remind them that might be a way to get some votes, go with support from eliminating food deserts. So this is what we're faced with. This is on the shelf. It has all these potato chips and stuff that lasts for 100,000 years or something, and we're trying to replace it with fruits and vegetables for a healthier community. It's one other thing. I don't have a slide for this because I was thinking about not using it, but I thought I should at least mention to you one of my suggestions for personal involvement beyond the politics of what we've been talking about is called cut the S's. That's cut the sugar, cut the salt, cut the smoking, cut the sitting, which means get up and exercise, cut the seconds, don't go out for the second helping, and cut the silence. The silence is just accepting what's going on as the status quo, and that didn't need to be the case. So cut the S's is something I'd encourage you to do on an individual basis. And this is striving for a social revolution, community-driven movement. There are lots of things we hope will happen between communities around the country. Just a basic return to community organizing. Now, in my experience, I found that the local politicians, know more about community organizing than anybody because they got to get the votes out. So take a look at working with them in their process of identifying block captains, building captains, you know, whatever the organizing element is, to bring about building this movement for social justice around health equity. Broad-based coalitions reflecting the elements of a healthy community and healthy individuals. A wellness focus rather than a sickness focus. And a part of being well is being politically active. Thank you. Some of your partners, faith community, politicians, artists, and athletes. A great Tommy Smith partnered with us on some youth development programs. You remember Tommy Smith from 1968 Olympics? Exactly. He's actively involved now in youth health and development throughout the United States. And academia, which has a role to play as well. Environmental change, that's another element for discussion at some future point. Environmental stressors, particularly placed in African American communities, which is in itself injustice. And the importance of power, as I mentioned before, it's a very important element of this. This is the documentary we talked about in the introduction. Now, if you've not yet seen it, I would encourage taking a look at this documentary. So it talks about social determinants and diabetes and infant mortality. It's a very, very powerful piece of documentary. So take the risk. This is a risky business. But the progress that we've made over the centuries has always been about taking a risk. Whether it's been taking a risk to run away, or to organize a revolt on the plantation, or to sit in at a lunch counter, or to sit down on a bus and not get up, vis-a-vis Rosa Parks. Taking a risk is what's got us where we are today, and I would encourage you to consider taking a risk. This is the Cape of Good Hope in South Africa, and we would ask that all of us stand on the bank, the edge of this precipice, and step off. And I heard a really profound statement about stepping off in risk and faith. It says if you take the step, and either you don't see nothing there, but you take the step, and either miraculously a bridge will appear, or you learn to fly, which is really profound. So either way, you're going to be okay. So I'm going to leave you with the notion of building this social movement. This is one of my favorite photographs of the civil rights movement in the 60s. And boy, if those signs could all say, we demand justice and health, we demand health equity, you know, we demand that the world reflect the fact that that health is a human right. That would make me feel so good, and we'd have such a long way towards equity in this world. So I want to share this one thing with you as I close about taking risks and how important that is. This is written by an anonymous author, so I can't tell you who wrote it. To laugh is to risk appearing the fool. To weep is to risk appearing sentimental. To reach out for another is to risk involvement. To expose your ideas, your dreams before a crowd is to risk their loss. To love is to risk not being loved in return. To live is to risk dying. To believe is to risk despair. To try is to risk failure, but risk must be taken because the greatest hazard in life is to risk nothing. So I'll leave you with that thought and wish you the best in terms of building this movement. The whole world is looking at you. I can tell you because of my involvement in national and international activities. We want to see Cincinnati and Closing the Gap as an organization being the lead for building this national movement for health equity and social justice, and once and for all, eliminating the barriers and differences that provide us shortened life expectancies, which are not fair, unjust, unnatural, and systemic, and we can do better. Thank you very much for your attention.